Reaching your 60s is usually a time of change. Maybe you've become an empty nester or have finally retired with dreams of traveling the world. Unfortunately, this time of change isn't always positive. For many men, reaching 60 comes with the threat of a cancer diagnosis. Prostate cancer is the most common annual cancer diagnosis for men. The CDC reports that more than 220,000 men are diagnosed each year in the U.S.
We clearly have very strong data that tells us that if you do have a history of prostate cancer in your family, a brother, a father, uncle, grandfather, but also other cancers in your family, a mother with breast cancer, ovarian cancer, there's pancreatic cancer in your family, that can increase your risk for getting prostate cancer, and for men and women, other cancers as well. So getting a good family history is super important.
That's Dr. Neil Shore, Medical Director of the Carolina Urologic Research Center and Chief Medical Officer of Urology and Surgical Oncology at Genesis Care US. He says that while prostate cancer is treatable, it can evolve into a much larger problem.
Approximately 10 to 15% of these patients will now have MHSPC, metastatic hormone-sensitive prostate cancer, which means the cancer cells have escaped the confine of the prostate. So they're out into the bones and the lungs, liver, and soft tissue, which oftentimes is lymph nodes.
Shore says MHSPC can spread in different ways. If it only moves down to the pelvic area, doctors are usually able to fight it with a combination of treatments like surgery or radiation.
Oftentimes, the more distant the spread, the harder it is to cure, but our goals are still powerful in that we're trying to put the disease into extended remission. So the advanced cancer can be a sort of a chronic disease to allow patients to live longer and to continue to live well.
As with many other cancers, the lifespan of men diagnosed with MHSPC differs from case to case.
On average, a lot of our analyses might say that about 30% of patients with MHSPC will live 5 years. I can personally tell you that I've had patients live much longer than that. Now, there's always different individualization. The biology and the aggressiveness of cancers are as unique as our own fingerprints on our hands. And that's one of the things that we continue to learn about. No two cancers, especially if they're prostate, are necessarily the same.
But even though no two cases are alike, Shore says the traditional treatment for MHSPC has stayed the same for the last several decades. Patients undergo both chemotherapy as well as a treatment called androgen deprivation therapy. It lowers the male hormone testosterone to help slow the spread of the cancer.
This was an effective therapy, has side effects like all therapies do, but in the last 5 years, we've had about 7 trials that have used combinations with the androgen deprivation therapy that have further prolonged survival and have overall been tolerated. There are side effects that should be discussed with your healthcare provider, and that could be your urologist, medical oncologist, radiation oncologist. But that's really the good news, is we're continuing combinations of therapy to have patients live longer.
This breakthrough combination adds a medication called Nubeqa to the existing treatment pair. The FDA approved Nubeqa in August following a global study that placed participants in one of 2 categories.
Patients received androgen deprivation therapy and a course of chemotherapy in one arm of the trial. And in the other arm of the trial, they received androgen deprivation therapy and chemotherapy and a third medication, an oral medication known as Nubeqa, that blocks the androgen receptor. And the bottom line of the study was that the triplet outperformed the doublet therapy, so much so that patients on average lived 32% longer.
But how does adding Nubeqa into the treatment help patients with MHSPC?
What we're always thinking about is how can we provide novel drugs that have novel mechanisms of action to fight the cancer cells. So in this study, the Arison study that led to the triplet approval by the FDA, when we lower the male hormone level, it's its own unique mechanism of action impacting the prostate cancer cell. Similarly, the chemotherapy that was used called docetaxel. And Similarly, using Nubeqa, also known as darolutamide, it blocks the androgen receptor.
So, with the use of Nubeqa, Shore says patients get 3 distinct drugs that each fight the cancer in different ways, which creates a sort of synergy in the treatment.
Cancer cells are tricky cells in that they ultimately find resistance pathways where they find another fuel to drive their growth. So that's why this triplet, we were able to prove that it was effective in prolonging patients' survival in comparison to just the doublet. The really good news is that 30% 5-year survival, we're seeing it increase. I've had patients who've lived 6 and 7 years.
And the progress doesn't end here. Shore says researchers are using this momentum to conduct even more clinical trials, trying to further advance the treatment options. In fact, he says this is an optimistic time for patients with MHSPC.
We're slowing it down. We're putting it into remission. And as long as we can keep the cancer in remission and prevent the development of new lesions in the body, whether it's in the bone or the liver, the lungs, or in lymph nodes and soft tissue, that helps delay symptoms, and that helps delay the need for other cancer therapies, as well as the important prolonging survival.
Information about the new FDA-approved therapy for MHSPC can be found at Nubeqa.com. You can find out more about Dr. Neal Shore and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Everything that I had tried hadn't worked. And when you have so many doctors blow you off, you're kind of like, well, maybe it is me. Like, maybe I am making it up.
A condition that experts say is severely underdiagnosed.
Then why we need to have more discussions around male infertility.
In men who have infertility and a male factor to the couple's fertility, those men are at increased risk for major health problems or even early death.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Keeping it clean, keeping it simple, just the facts. What is it that a smart professional would need to know about what's happening in the world today?
We've heard of snackable social media content. What about snackable journalism? Then,
kids are curious, so it's just natural inclination to just, let me just Google this word I heard that I don't even know what it means, or something silly with my friend.
The tips your kids should know when getting a cell phone. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.